Our surging COVID positivity rate and hospitalizations can really take a toll on our mental health. Doctors say many of us are impacted in some way. Joining us is Harvard Healthcare's Dr. Andre Newfield, Chair of Psychiatry at St. Vincent's Medical Center, to help guide us through this. Good morning. Thank you so much for your time, Doctor.
Good morning, Alyssa. Good to be with you.
So my first question for you this morning is there anyone not impacted emotionally in this recent COVID surge?
I'd say the broad answer is virtually no, but I think the more important question is who's most impacted. And I think it's really those that have been most isolated before. Many of them might not necessarily feel a change, but most of us need to be in touch with somebody or sort of have people to reach out or have a support network. I'd say also those who have suffered mental illness before and those who have been sort of feeling the burdens of financial stresses before. All of those things make the most vulnerable amongst us.
Yeah, I think we are all impacted. And Dr. Newfield, I have to ask you this. You know, a year ago, we were dealing with the vaccine rollouts. A lot of people were hopeful. How would you describe how people are feeling now compared to a year ago?
I think for the most part, people are feeling a bit more run down and a bit less hopeful. Around this time last year, vaccines were just rolling out, and we had hoped we'd be in a better place at this point. And, you know, it's changed. It's much more transmissible. Seems to be a little bit less, taking a toll in terms of hospitalizations and in terms of fatalities. But it's just people are generally struggling after all this time and having been hopeful that we'd be in a better place right now.
Absolutely. It takes a toll, as we have been saying, on all of us. Are there any signs that we should be looking out for when it comes to our loved ones? When really should we be worrying about those around us who have been so impacted by this COVID-19 surge?
Yes. Well, again, the people to be most concerned about are those that have had, from mental health care standpoint, those have had a history of mental illness. People have suffered depression and anxiety, people who are on medications. I think what we always want to look out for, particularly in that population, but in general, is significant changes in function, changes in sleep, changes in appetite, changes in function that help people, get out of bed and do the things that they need to do, whether it be to go to school or go to work or care for those around them or care for themselves.
Right. What can we be doing, all of us, to help stay mentally fit?
I think, trying to take hold of routines that are safe and healthy, trying to exercise, trying to get consistent, good amounts of sleep that is restful, trying to do activities that provide a little bit of comfort, whether it be cooking and eating foods that you like, or watching shows that are, accessible now online or, on broadcast systems, and trying to avoid certain maybe less healthy things such as, substance use. A glass of wine a night, especially under these circumstances, can pretty quickly turn into more or perhaps even other substances. So all of those things together will hopefully provide people a sort of regimen to keep them feeling healthier and safer.
Absolutely. We've been saying this for about 2 years now, but we are all in this together. Thank you so much for your time, Dr. Newfield.